So, a lot of you know what chiropractors do, but you're kind of confused about what physical therapists can help you with. Did you know that chiropractics and physical therapy are not mutually exclusive services? Meaning that if you have a special type of pain or certain type of pain, that you could see a chiropractor and the physical therapist, or you can choose one service over the other if that's beneficial to you. And a lot of people don't know what's available to them. So today we are exploring the difference between chiropractics and physical therapy and how to know if you should choose one over the other. Welcome to Fearless Fridays, where we are talking about everything health and wellness related. My name is Dr. Melissa Chofi. I am the owner of New Quest Physical Therapy, a mobile practice serving areas in New York and Connecticut. There is so much misinformation out there in regard to the medical field, and with our healthcare model increasingly putting profits over patients, you as consumers need to be given all the tools you need to demand what you deserve, ensuring a strong, resilient, fulfilled, and fearless life. My goal is to empower all of you to stand up for yourselves and be able to call bullshit in a realm that is confusing as fuck. Let's get into the episode. So I participated in a wellness event this past weekend, and it was really, really awesome. And there was a chiropractor there, and he came up to me like giving the sign of the cross, and he's like, "Oh my God, it's the enemy! Oh my God!" And because I'm the education lady, I decided to educate him on the fact that I don't take clients away from him, and he doesn't take clients away from me. And in fact, our services are very different, and we are targeting similar ailments for our clients. So I'm one of the few physical therapists who do not slam chiropractic care. I actually think that it might be a good adjunct to your physical therapy treatment. We just have to approach it in a way that's all encompassing and making sure that we each are reaching your goals and that our services together are giving you exactly what you need to be where you want to be. Just like physical therapy, chiropractics was founded upon the idea that they didn't want their clients to undergo invasive procedures such as medication, surgery, injections. They wanted to be able to provide a service for their clients without having to go through that. And it was founded in the late 1800s with the focus on spinal manipulation and joint adjustment, similar to what we think of when we think of chiropractics today. With chiropractors, it's a reliance on passive treatment, meaning that they perform these manipulations to your body, and afterwards you feel really, really good. You can go about your day to day without, a lot of times, without pain, and relief may be more immediate than when you're seeking treatment for a similar ailment with physical therapy. The only difference being that with chiropractics, the relief could be short term, which is why clients have to keep coming back for maintaining that pain free term that they're looking for. The chiropractor himself or herself is doing all the work for you. You're not really doing much at the time. They're not really movement experts like physical therapists are, so the exercise prescribed, depending where you go, could not be specific enough for you or challenging enough for you, depending on your point in your recovery process. So also the time sessions with a chiropractor are typically shorter than with a physical therapist. Typically around like 10 to 20 minutes, give or take. And because it's more passive, it's more likely that you're going to be going to your chiropractor for a longer time than you would a physical therapist, because you're not learning how to keep your ailments at bay and prevent what's going on from happening again in the future. So now, what does a physical therapist do? And the first hurdle we have to overcome is that a lot of people think that physical therapists just deal with the geriatric population and people who have undergone surgery, when in fact, what I tell everybody is if there's something physically holding you back from living the life you love, a physical therapist can help you with that. So there's many specialties, including vestibular rehab, women's health, which is what I do, orthopedics, like cardiopulmonary issues. All of this a physical therapist can help you with. So there's many realms to it. The second level of confusion is that some chiropractor offices will market and advertise the fact that they have physiotherapy, which is not a protected term in the US, as far as I know. Correct me if I'm wrong. So what this usually means is that they offer electrical stimulation, ultrasound, hot and cold packs, which these are just modalities. It's not physical therapy. And if that's the bulk of your physical therapy treatment, then you need to run, because those are just a waste of time. So for physical therapists, we live by the idea that movement is medicine. We use observation about your strength and your endurance during your movement assessments upon evaluation to provide your plan of care. Some of us do offer passive treatments like hands-on stuff and soft tissue work and joint mobilization, as I mentioned before. But the predominant course is we are not here to fix you. You have a very active role in your recovery process, meaning that you have to move. So we teach you exercises to do that. We progress those exercises as your needs change and as you get better, so that you're able to take on a larger load and be able to live your day-to-day lives and your recreational lives as comfortably and as optimally as possible. So this is the main difference, is that our exercise programs are very, very highly structured towards our clients, and we do a mix of passive and active interventions. The predominant plan of care for physical therapy is movement-based and exercise-based. And this is what sets your nervous system to performing as optimally as it can. So while the manipulations might feel great with a chiropractor, the reason why you have to keep going is because you don't have those exercises given to you to optimize that new range that your body just learned. So your body is like a roadmap. So let's take you through an example. So if I have a woman coming to me, she has lower back pain, and I feel like manual treatment is appropriate for her. I'll work on her back. I might do mobilization to her spine. Then I'm going to take her through a series of movements and progressions and loading and strengthening exercises appropriate for her, to be able for her to take on a load. And what this does is moving through that available range that I gave her temporarily, because it was passive, right? So anything done passively to us is only a temporary solution to a long-term problem. Passive solution is very temporary. I take her through that exercise progression. This is where the long-term solution comes in, being that your brain is making a new roadmap that your body's not used to yet. So this is the important part of that puzzle piece, in that your brain and your body need to learn those new movement patterns to be like, okay, this is not a danger to me. I don't need to be in pain. I don't need to guard anymore. And this grants you a greater freedom with your life and your motions. And because all of this is involved, physical therapy sessions tend to take longer than something in a chiropractor's office, where our sessions are anything as small as 30 minutes to anything as large as 60 to 90, depending on what your ailment is and depending on where you're going. So another thing that I've seen frequently with the chiropractic websites is that they say that physical therapists don't treat the nervous system. Whereas if you listen to my explanation of how the nervous system works and the brain mapping and all of that, you'll quickly realize that we do a lot of work with the nervous system as well. So both chiros and physical therapists work with the nervous system. That's what's setting your movement patterns. That's what's getting you better. And that's what is preventing you from needing to come back to us in the future. So earlier before, I mentioned that chiropractics in conjunction with physical therapy might be a good resource for you. An example of that would be if you're having back pain. So a lot of people will have pain in their back and they've been dealing with it for years, and they're like, oh, I just go to my chiropractor and he wants to see me every week for whatever. This is a great example of how we can work in conjunction. So you go to your chiropractor, he does the manipulation, you feel really awesome. Then you come to me and I tell you the exercises to do, and I progress you through that program to reteach your nervous system how to accommodate for things that you're going through day to day. This way, your body learns all these new movement patterns, how to take on a load, and it prevents you from needing either of us in your future. Because life is short, guys. Like, we don't have time to waste. So do you really want to spend the rest of your life with me or your chiropractor just to feel good and to be able to get a good quality of life? And I don't think you really do. And then an example of when physical therapy might be appropriate. And I'm just using this example because I saw it posted on social media one day and I was like, what? So this woman had hip surgery and she was looking for a chiropractor. And I'm not saying, again, I'm not slamming chiropractors. I think there are some really, really great chiropractors. But for something like post surgical, your issue, it may be a range of motion issue, but it's mostly a movement issue. So they're not going to be able to teach you how to move appropriately and progress you through a strengthening or a mobility program like a physical therapist may. And just going to a chiropractor and getting stretched if you have a new hip is not going to teach you how to use that new hip optimally, if that makes sense. So at the end of the day, chiropractics are not bad. I actually believe in some of them. You just have to retrain your brain how to take advantage of that newly acquired range of motion that they provided in their office. But if you're not getting appropriate exercise suggestions and you're not being progressed, then how are you going to be able to prevent the same problem from happening again and staying out of either of our offices? And that's where a physical therapist comes into play. There's a reason why you're going in and out of pain over time if you're just seeing a chiropractor. You just need to learn where that pain is coming from, how to address it, and how to prevent it from happening again in the future. Being fixed with just passive treatments alone is not going to help you. It's not going to create those new neural pathways. It's not going to provide a long-lasting input into your nervous system to be able to decrease your tension and your guarding and prevent future problems. So this is where a good mix of chiropractics and physical therapy come into play. So just remember, guys, keep educating yourselves, ask questions, demand the life you deserve, and most importantly, stay fearless. And we'll see you next week.